Hey guys, we're going to talk about pacing. I'm going to go over transcutaneous and transvenous pacing, and I'm going to post this video for ICU and the ER. This is not something we do very often, so whenever we do these, we're always trying to find all the equipment and where everything's at. So hopefully, you'll remember this video and be able to do it smooth next time it happens. So for transvenous pacing, what you're gonna need is you're gonna need the pacer box. It looks like this. There's a couple of different models. One has like a black case, but they basically look like that. And then you're gonna need a set of cables, and the cable looks like this. It's got this kind of end right here like that. And so the cable plugs in directly to the pacer box, and it's gonna have an A and a V side. And so A is for atrial, V is for ventricular, and for transvenous pacing, we're gonna use the ventricular side, and it just plugs in and attaches just like that. Then the other piece you're gonna need is this temporary pacing electrode catheter kit. And these are located in the ICU, CCU, or in the cath lab. I think the OR has them also. And in this kit, you're gonna have your pacing lead catheter right here. It comes with a little syringe. It has these little lead pins, and it has the introducer right here. So you're gonna set this up right after the introduction. You can do it right before. You just got to be careful that that you keep the rest of it sterile, so the doctor can set it up for you while he's sterile. And this little syringe is going to hook up right up here, and these leads are going to go right here. The pins are going to go one in each one of these wires right here, and then these are going to hook up to your actual pacing wire. They have these little knobs right here, and so you're going to put one in each side, and then you're going to tighten the knobs, and that'll hold them in place. Okay, so now you're ready to go, and the doctor is going to put this probably in the EJ. In the IJ or the EJ, but most likely in the IJ. So he's going to put this in right through there, and it's basically just a 5 French big catheter, and take the needle out, and this is going to stay in. The hub is going to be sticking out, of course, just like a regular IV. And then he is going to put the catheter wire right through there, and once it's in a certain place, he is going to inflate that little balloon right there. You see it? And then that balloon will stay inflated as he floats this from the right atrium to the right ventricle. Now, as this is going in, okay, you're gonna have your pacer on. Here's the on button. And it's gonna come on, do its checks, and you're gonna see that the rate is set at 80 and the gain is set at 10. This is the atrial and the ventricular. So we're gonna do the bottom one, that's the ventricular one. And I will turn that up to 15 just to begin with, kind of give you like a middle place, not all the way up. And as the doctor is floating this in, you're gonna see pacing spikes on your EKG rhythm, okay? But what you're looking for is capture. So once he gets it into the right place, your rhythm's gonna change, and you're gonna have capture on your monitor. You're gonna check your pulse, and your pulse should match your rhythm rate. So if you're pacing at 80, your pulse on the patient, when you manually check it, should be 80. And that's how you know that you're in the right place. As soon as that happens, he's gonna stop floating, and he is going to deflate this balloon, and that's gonna stay there, okay? So then you'll secure this to the patient with a central line dressing, and that's it. You're pacing this guy internally. For this kind of pacing, you're not going to need a lot of sedation, if any. It's a very low power, so the patient shouldn't be uncomfortable. They might feel it, but really it should be very mild. Now, if we're going to do transcutaneous pacing, that's a different story. So for transcutaneous pacing, you're going to get your LifePak 20, and you're going to put the patient on the pads and on the leads. So you need the 3 leads and the pads at the same time on the patient for this procedure. So I am going to show you on the monitor, okay? This is, let me turn it off real quick. So this is a patient that has We're gonna say a sinus bradycardia. Make sure it's picking it up. Okay, sinus brady starting now. And you'll see it go down to a rate of about 40. There it goes. Usually these patients are on some kind of heart block, a second or third degree heart block. And they're going to be very symptomatic. So they're going to be diaphoretic, their blood pressure is going to be super low, and you got to do something to get this patient's blood pressure up right away. So we are going to pace this patient. If you can, try to give the patient some sedation first, like some Versed or some Ativan, something pretty strong, because this is not going to be comfortable, okay? So you're going to go right over here. Remember, the patient's on the pads and the leads. And right here, it's where it says pacer. You're going to turn that on. Now, when you turn it on, you're going to see that on each beat, it's going to give that little triangle on top. That's just the machine synchronizing to the patient. And it's going to say rate. So a rate between 60 and 80 is okay to start with. I don't like to start any higher than 60, so I leave it there, but you can go up to 80 if you want to. And then you're going to go here to where it says current. Now, when I hit current, it's going to be at 0. All this is doing right now is synchronizing. It is not giving any power yet. You have to turn up that current. So as I turn the current up, okay, to 10, you're going to start seeing some pacing spikes. So you see those little spikes in between each QRS? That is what the pacer is doing. But notice that they're not related to the QRSs. So you're going to keep going up on the current, and you can go up pretty fast, as you know, and you're going to be watching that rhythm, and it's still not capturing. It's still separate from the QRS, right? The QRS is still the same with that one. And now we have a change. You see? So once you have that capture, the first thing you want to do is you want to check your patient's pulse, because you know it needs to correlate. Just like when you're doing transvenous, you always want to check your patient. Patient should start improving. You should be able to get a blood pressure. The number will go away, and then you'll just see your rhythm right there. And you should be able to see this if you have your bedside monitor leads. You can see it on your bedside monitor also. But always check your patient afterwards. You know, if your patient doesn't have a pulse that's correlating to this, then you might need to stop pacing and do CPR. So you know, you always want to make sure that you're not treating the monitor, you're treating your patient. Anyway, that's pretty much it for transvenous and transcutaneous pacing. I know that we didn't go over a lot of it in detail. Just try to keep it simple so that you can at least know, you know, the basics and where to get the things that you need. Always know you can call ICU nurse to come down for these procedures, and the intensivist to help the ER doctor. These patients are going to end up in ICU anyway. So, you know, please just reach out, let your charge nurse know to come grab us, and we'll come down and help you out. If you have any questions, make sure you post them on the Facebook page so that I can answer them for you. All right, hope this helps.